surveying will include surveying of the diagnostic cast and drawing a tentative design. You examine the occluded diagnostic cast. You survey and design your master casts after you make your final impressions. You do tripoding, and then you mark your components. Now, I'm going to be telling you a color code of what color codes are supposed to be specifically used when you're drawing your diagrams and specifically drawing your components. But let's first see what is surveying. So we all know that GPT-9 is the Bible for the definitions, and you have to follow GPT-9 definitions only. I'm not going to be reading out the definitions to you. That's something that you need to read, you need to memorize, but I'm just giving you a brief layout of how you must be reading, how you must be memorizing, and what kind of diagrams and what kind of knowledge that you must have in your framework of your mind to help you write your answers. So surveyor definition, and the most commonly used surveyors is a NACE surveyor and Jelenko's will surveyor. That's the diagram. Beautiful diagrams have to be drawn. Practice them. I'm going to be telling you your 10 commandments at the end of this presentation, but that's how a diagram should look like. You must have on the right-hand side all the different captions which your diagram is going to be showing you. So that's how a surveyor looks like, and that's what are the different types of a surveyor. Now, these are the individual tools of a surveyor. So you can see left is your analyzing rod, then you have your carbon marker, your undercut gauges, and your wax knife. What is surveying? It is the analysis and comparison of the prominence of the intraoral contours associated with the fabrication of a dental prosthesis. So what do? You place the cast on the surveying table and at the 0 degree tilt. That means you do not give a tilt to the surveying table. Then you're going to be putting your surveying tools, and you're going to be seeing the parallelism between your abutment teeth. So as you can see here, these are your paralleling rods, and that's going to be deciding your path of placement or your path of insertion for your denture. Next, you're going to be checking for the retentive undercuts. Now, can you see this triangular area here, which is particularly when you see this triangular area, what you draw is your undercut area here, just below your paralleling tooth. That's your triangle, and that's going to be showing what's your undercut that is present when you are applying your analyzing rod. You check for the soft tissue undercuts. You mark your survey line. So that's your height of contour, because that's your maximum bulge. And as you can see, your carbon marker, you're marking your survey line. The area below the survey line is your undercut area. So that's how is a diagrammatic representation of what surveying is all about. Now, height of contour is a term that you must know. That was first coined by Kennedy, and Devan was the one who gave the term suprabulge and infrabulge area. The above the height of contour is suprabulge, below the height of contour is infrabulge, and that's how your direct retainer is going to be extremely important, because these are your areas which are very, very important. So this is the diagram. It's like an egg anda. That's your egg. So egg, you draw your survey line. Your egg is going to be representing your tooth. You have your height of contour and your suprabulge and infrabulge areas. So this is, again, a very important diagram that needs to be drawn when you're talking about surveying and survey lines. Prothero's cone theory, very important again. So it's a pair of cones which share a common base. That's your height of contour, and that's what is important. The Prothero's cone theory is something, if you want a cutting edge in your answers, you need to mention these terms. Very, very important. Now, these are the type of different survey lines. You can have a high survey line, medium survey line, low survey line, along with the diagrams to be drawn, and you can have a diagonal survey line. So again, different types of survey line as per your surveyor and your path of placement. That's the undercut gauge, as I showed you already, the triangular area where you can see that's to measure the kind of undercut or the depth of undercut that you particularly have on your cast. Now, look at this on the lower left side. These are your color codes which are given, and what you can see, what is marked on the cast are your rests. All your rests have to be always marked in red. So when you're drawing your diagram also, red is the color code for the rests. The The brown pencil has to be used for the metallic portion of all the components. The blue portion is for the acrylic portion, that's your denture base and your teeth. And your black pencil is for all your survey lines. So that's the color code that Stuart gives, and that's what you need to follow when you draw your diagrams. So now, as you can see here, all these rests are drawn in red, and that is particularly what your rest seat, it can be an auxiliary rest or it can be a part of your direct retainer, but they have to be marked and outlined in red. So that's what you do when you survey and you design your direct retainer and your rests. Now, as I said, surveying is very important to determine your path of placement, and these are your 4 factors. That's your guide plane, your undercuts on the teeth and soft tissues, your aesthetics, and your interferences, which are going to affect your path of placement. Again, very important 4 factors, and you must know about these 4 factors. More detailing about them, please read and draw with diagrams. Next, tripoding. I know understanding tripoding at the undergraduate level is a little difficult, but I said that when you put your cast on your table, it has to be a 0-degree tilt. That means there is no tilt anteroposterior or lateral or any form of lateral tilts. So when you do give a tilt in order to alter your path of placement, then you want to reorient your cast back to the same tilt. That's where tripoding comes. That means tripoding helps you to reorient your cast to your appropriate tilt that you have selected, which can never be more than 10 degrees. So you mark specific points which are either on the tissue portion of the cast, which are not going to be a part of your design, or in the outer surface, that is the index portion of your cast. You're going to be marking points so that those points can be scribed onto, and the same kind of points have to be touched upon by your paralleling tool when you reorient your cast. So 3 points to be marked in the same horizontal plane, and those are going to be helping you to reposition your cast on your dental surveyor, and that's what is the basic need and reason why tripoding is done.